Hello, welcome to the 11th hour, navigating through the end of life. Tonight, we're focusing on the team members involved in providing hospice services to the individual receiving hospice care. You may want to know who's included, which disciplines should I be expecting to come and provide care for either yourself or someone you know who's receiving hospice care. So tonight, we're going to discuss the routine disciplines involved in providing those care, as well as additional or supplemental services that are available for either yourself or someone you know who's receiving hospice care. Let's get started. Have a seat. Let's start this conversation. All right, so let's begin our conversation tonight. And tonight we're discussing the disciplines involved in providing the hospice services to the individual who is currently on hospice care. Before we speak about the individual duties of those disciplines, there's a key word that I want you to know, and it's called the interdisciplinary team. Now, the interdisciplinary team is made up of your team members as well as additional members of the hospice care. To begin with, we have the hospice physician, who is, let's say, the one in charge to sit in every meeting when we are discussing our patients to know what interventions are working and where we need to make some adjustments, as well as how's the person progressing on hospice care. So that is your hospice physician who makes the final decisions in regards to medication and the care of the patient. Next, we have the case manager, who is the nurse. Now, the nurse is the one who is really in charge on a daily basis when it comes to what is going on with the patient. So the nurse oftentimes will see the patient once or twice per week, depending on the situation that's going on with the patient. Now, that frequency is not set in stone. It is at any moment can be changed depending on the needs of that patient. So even though we say it's once or 1 to 2 visits per week, there's a possibility where it will increase or it may decrease to the standard, which is 1 to 2 visits per week. Now, the nurse, based on her assessment, I said her, I should really say based on the nurse's assessment, because it could be a male who is providing nursing services to the patient. Based on the nurse's assessment, the nurse will refer the information back to the medical doctor to see if there are any changes that needs to be made to the medication, maybe the frequency, maybe the routine, the doses of the medication, those sort of things. So the nurse would communicate quite often with the medical doctor, with the hospice doctor to change or tweak certain things to find what works for the patient. After the nurse, we have your social worker, who is the individual who we refer to as a person who wears many hats. So in that capacity, as the social worker, we are responsible for, number one, providing the emotional support to the patient as well as the family. Because on hospice, while the patient is our primary focus, we do take the entire family into consideration because it is entire system from a holistic point of view. If the family is healthy, then we know for sure the patient will receive the necessary care and services from the family. But if the family is not healthy, then we know it will impact the patient's well-being. So while we focus on the patient, we do pay a lot of attention. We do include the family within the care of hospice as one unit or one system. So the social worker will provide the emotional support for that system, as well as ensure that the finances, or is there any issues going with the finances? And if there are, what steps or what interventions must be put in place in order to find resources to assist the family who is having some financial issues. We'll get into those particular topics on a later segment. On this episode, we're simply focusing on who are the key players in on your hospice team. So we've already said the hospice physician, who is primarily there doing the interdisciplinary meetings. But then we have the case manager, who is the nurse who is in charge of the patient's care within the home or the private setting. It is the nurse who governs the other disciplines. Let's put it that way. Then you have your social worker, who is responsible for the emotional aspects, the psychosocial process of the patient as well as the family. But believe it or not, we also focus on the team members who's providing care to make sure that they're doing well and that they're not having caregiver burnout or having their personal issues that may impact how services provided. We all have issues. Sometimes things may get a little stressful, and then we, as a team and family, we certainly talk to each other and provide support. Apart from a social worker, at this point, we are going to speak about the chaplain. We have a chaplain involved in the team who provides the spiritual care, spiritual support to make sure that the individual receive that spiritual aspect. That is a major component near the end of life. Believe it or not, we have many families and patients near the end of life. Spirituality becomes a pivotal point. And that is the specialty of hospice, to have all these resources under one umbrella to service the patient who is dealing with a terminal illness and who needs all the compassion and support that we can offer or that is available within the community. So what a great support to have a chaplain who can come to the home, schedule an appointment, come or facility to provide spiritual care. The patient does not have to go to a local church service, although we have patients who are still connected with their community service, and their ministers, pastors, bishops, rabbis will come and visit. We also have that spiritual aspect as an additional component. Then we have our CNAs. Now the CNAs are really the backbone of hospice. Without the CNAs, honestly, I don't think hospice would be hospice without CNAs. And if you are a CNA watching this, hats off to you, because I honestly think the CNAs are the angels. They are angels walking on this earth. Now, the CNA is the one who is responsible to have that intimate relationship with the patient receiving hospice care in terms of providing a shower or bath. And I say it's intimate because that's quite personal. But our CNAs are professionals. Any CNA working through hospice or any CNA in general. These are professionals who went to school, received their certificate, um, and are certified to provide appropriate care for either you or your loved one or someone you know. The CNA will come in and introduce um, herself or himself to the patient, get to know the patient on a personal level, and take it a step at a time, until the patient feels comfortable enough to allow the CNA to provide the necessary care in terms of a bath or grooming. Now, again, like I say, this is really personal and very private. In certain situations, it takes time to build that trust between the CNA and the patient. But oftentimes, I've always seen it, even the most reluctant patient, at the end of the day, can't stop saying how much they simply enjoy the services of the CNA, who is our certified nursing assistant, CNA. So we've spoken about the hospice physician, and the role of the hospice physician is to govern the team. The physician is in charge of governing the entire team, and every hospice may have um, several teams, and each team has a physician, or it may be one physician servicing two or more teams, but each team has a physician to sit within every meeting to listen to what is going on with the patient and to provide the medical guidance needed for the team to do what is necessary to make sure the patient is comfortable. Then we have our nurse, who is the case manager, who manages the case and knows when to say, hey, we need the social worker to come out and assist the family, or we need the chaplain, or perhaps it's a CNA. They need to schedule the CNA, and it's the nurse who will determine how many days per week the nursing assistant will come and provide care for that patient. Okay. Then we have, again, the social worker is your third one. And we have your chaplain, the fourth discipline. Then we have the CNA, the fifth component to your team. Now, primarily, you're not going to see the medical physician on the schedule because, again, they have multiple patients to do evaluations on and to assess and to make sure that things are running as they should be for the patients. Who are you going to see on a routine schedule? Your nurse, your social worker, and the chaplain, and the CNA. And even with that being said, the social worker you may see on a schedule of maybe 2 times or twice per month, or maybe it's once per month. Again, it goes back to the need of the patient. The schedule is there as a standard, but really the frequency is set between the discipline and the patient receiving the hospice care. So the schedule can be changed at any point. The hospice team is there to service the patient. We work with the schedule of the patient, and we try to be flexible in every aspect to meet the patient's need. We're not there to impose on the life of the patient, but we are available to make our schedule conducive to what is reasonable for the patient. Your chaplain as well is basically the same schedule as the social worker. So their schedule is typically once per month, but again, that's between the chaplain and or spiritual care coordinator with the patient. Perhaps the patient wants the chaplain twice every month, or once every week or 3 times per week. It's up to the individual in that discipline. The CNA is typically 2 to 3 visits per week. Yes, 2 to 3 visits. Depending on the situation, again, that schedule can be changed. Um, and that's a conversation between the nurse, the case manager, the CNA, and the patient receiving the care. Is there availability to give more days, or do they need to reduce the days to meet the patient's needs? Some patients, and again, our patients' demographic is typically age 65 and older. But again, like I said, hospice can be at any age as long as a person meets criteria for hospice services. It's not really a number or age, it's the illness. Is there a terminal diagnosis that warrants the need for hospice services? Now, with that being said, our elderly population on hospice don't normally want a bath or a shower every single day. They much prefer maybe twice or 3 times per week. And bear in mind, we are going into the private residence of these individuals on hospice care if they are still residing within their private home. And we do want to respect that. If they so choose to only have the CNA twice or 3 times per week, that will be the schedule. Within the nursing home or assisted living, there are additional CNAs providing the same services as the hospice CNA. The difference is that the hospice CNA is trained to deal or to provide care for an individual who is currently on hospice services with a terminal diagnosis. Yes, they receive special training to know how to deal with situations that may arise, and they also take additional courses through hospice to know the best approach and how to reduce tension or stress or anxiety related to hospice emotions or hospice fatigue, or you get my point. So there is a slight difference between a hospice CNA and a CNA who is providing services maybe at a nursing home or assisted living. There's additional learning that goes into the hospice CNA. So those are your 4 main routine disciplines who will go into the home. I also want to discuss the supportive disciplines that may or may not be assigned to the patient receiving hospice care. We have additional services such as pet therapy, music therapy, and volunteer services. Now, the volunteer services are typically once every week, but every hospice is different. And I will leave that between the patient and the hospice who is providing care for them to decide on the frequency or time that they would like to receive volunteer support. Now, that is a bonus and just a wonderful component to hospice to have a volunteer. So if you are watching this and you are a caregiver, you're providing care to your loved one who is on hospice services, you may need a break or two, or you simply need to run to the doctor's office for a quick appointment, or perhaps you just need some me time to go and just go grab a bite or get a shampoo, whatever it may be. We have volunteer support. Now, I say we because the hospice companies that I've worked for, they all had a volunteer department. Now, check with your hospice, your local hospice, if your loved one is on their hospice, check with them and find out if you're not currently receiving volunteer support, find out if they have this service available. take advantage of it. It's free of charge. It comes with the hospice services. So if you need to take a break, a breather, we don't want you to get burned out. Take some time, and the volunteer will be assigned to your loved one, or yes, to your loved one, to come and sit with your loved one as a companion. Bear in mind that volunteers are not allowed to do any hands-on care with your loved one or someone you know who's on hospice. Keep that in mind. They do not do any hands-on care. They are more of a support mechanism, to be a companion, to sit there and keep eyes on the individual receiving services at the moment where their caregiver will not be available for about 2 to 3 hours. So that's a bonus. We also have music therapy, and the music therapy, I really don't need to explain it, but when you hear music therapy, it's not someone who comes to the home or facility to play music on the phone or the tablet. Like, everyone can go to YouTube or Spotify or whatever source where you get your music from and play it. No, these are trained, um, certified, board certified music therapists who learn certain chords, certain keys, tone, to help reduce stress. Maybe someone who's in pain. In addition to medication, there's music therapy to reduce the level of pain that individual may be experiencing, or sometimes it's just soothing, and it distracts a person from what they're experiencing. Anxiety. Now, I've done a lot of referrals for music therapy for the individuals that I serve as a hospice social worker. And majority of the time, it was for anyone who was anxious, those with depressive moods. Music just simply helped them to calm down, or to remind them you're still special, you're still unique, you're still valued. So we give those special accommodations to help them remember you're still loved. Now, there's also pet therapy. We have a lot of pet lovers, and one of the things they reminisce on is, I will never see my dog. I miss my dog. Or my dog passed away several years ago, a couple of years ago, or perhaps last month, and I don't know what I'm gonna do. I just miss my puppy, my dog. I had my dog for so many years. Well, again, check with your hospice provider. Not every hospice provider has pet therapy, but I think majority of them may have that service. If that is something that is of interest, again, reach out to your hospice provider and let them know, I am interested in receiving pet therapy. Do you provide this service? And if they do, sign up for it. Sign up for it. Okay. Um, and at this point, we've discussed the disciplines that are constantly involved in your care. In addition to that, we have the supportive services. And yes, I'm looking at a little note, just remind me of the topics that we need to cover so I don't forget anything. Um, the other service that's, I should say, discipline that's behind the scenes, doing medical diagnosis or medical assessments, excuse me, assessing our patients, are the nurse practitioners. Now, we do have nurse practitioners who will go and do what we call face-to-face evaluations to make sure that the patient continue to meet criteria for hospice services. The nurse practitioner will go ahead and recertify that individual. I think we've covered quite a bit tonight. So you have your your hospice physician, number one. You have your case manager, who is the nurse and the one who oversees the care of the patient. routinely. You have your social worker who's responsible for the emotional aspect, the psychosocial aspect, assessing the patient and the family and the entire system, knowing how to de-escalate situation, conflicts, and emotional distressors that may present themselves. There's so much going on hospice, but we try so hard to make it pleasant and comfortable for the patient. We take everything into consideration because we want that patient to enjoy every moment of his life or her life. This is their time, this is their moment. Everything's focused on that patient. We have, again, our chaplain, we have the CNA, the certified nursing assistant, then we have the supportive services of music therapy, pet therapy, and and the volunteers. These are the disciplines that you will see on a routine basis who will come and provide that compassionate care. If you have any questions concerning the disciplines involved on the hospice team, feel free, send me an email. I will address it during our next episode. And if I forgot anything, we will discuss that again during our next episode. Thank you, and I hope you enjoyed this conversation.